Okay, I'm sorry. I'm back again with this thing because it's just a big mess. The CDC director is being drilled. You have to watch this. Why are we only testing people who are coming from China when the outbreak is in 45 other countries and growing? And people are transmitting it even though they are asymptomatic. And his reply is...
Working very closely with the FDA. They have been very supportive. I just want to make sure that
he doesn't know. Okay, he's been rambling a lot, so I'm going to spare you from that, but he's saying that we're talking to hospital leaders.
For us, there's not a lot of flex in our health system right now. I mean, most hospitals right now, because of influenza, if you're looking at them, they may be at 95, 96, 97% capacity. This is why I stress that our current public health response, that multi-layered response, is containment, 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 containment.
Containment to buy us time for a vaccine that's going to take about a minimum of a year to 18 months. But there are, 33 confirmed cases in California, over 8,000 people that are being monitored, but we're only testing people who came from China, who are showing symptoms. I feel so... Sorry, I couldn't find the word. I feel so reassured and just so safe as a healthcare worker. Yes, I do. This is so fun. It's better than Dumb and Dumber, my favorite movie. Look.
Is the canary in the minefield.
He has a plan. I
can see when and if we're getting community. I don't have to wait till an individual gets hospitalized and is on a ventilator.
Oh, good. Good.
I have to be honest with you. We don't know.
We don't know. Nope.
What we're going to find.
We don't know anything.
But we're very anxious to get this broad coronavirus surveillance system using all the systems that we have right now for respiratory disease and get that operational as soon as possible.
That sounds great.
See the trends that we may be seeing that in fact demonstrate that we're looking at potentially an outbreak in a locality or in a state.
Absolutely, and then be able to.
We're going to have an outbreak. Okay.
Public health approach of case recognition, isolation, contact tracing to try to make sure that cluster is contained.
And do you have the financial resources and the employee capacity for this surveillance system and what you need into the future?
Well, I will say that's one of our tracing to try to make sure that cluster is contained.
And do you have the financial resources and the employee capacity for this surveillance system and what you need into the future?
Well, I will say that's one of our...
Do you have the financial stuff you need and the employee capacity?
Surveillance system and what you need into the future.
Well, I will say that's one of our major components of the supplemental that was put forward.
We don't have it yet.
For us to roll this out nationally.
Great. Okay, don't touch that button. This is the best part. I love this guy. I want to meet him. Hold on.
Military. The Washington Post published an article. Headline is, "A faulty CDC coronavirus test delays monitoring of diseases spread." So my first question to you is, does the CDC's test for coronavirus work?
Yes.
Okay, what is the error rate on that test?
So we created a test really very rapidly based on the sequence of the virus, within really a week of the sequence being published. And it's a PCR-based test. And the way it was designed at CDC was it actually measures 3 different, if you will, components.
I just need to know the error rate.
Me too.
Well,
if you know it.
Yeah. The problem was when the test was sent to the states, one of the components had a contaminant in it. Scale up to the state.
Has the CDC fixed it?
It has been corrected, and there are tests that are being shipped out as we speak.
Yay!
Okay, so in fact, the first test didn't work.
First test works because it was developed at CDC and it works fine. We test everyone in the country. When the manufacturer scaled to send to the states, when the states got it, it could tell positives, it could tell negatives.
So it doesn't work.
Because of one of the contaminants in the control, there was another
contaminated.
That was, we don't know if it's positive
defective.
Or negative. It was inconclusive.
Inconclusive.
The FDA
there we go.
Requested that we not use that test and have people send it to CDC, where the initial lots that we made were quite functional.
So those people were not contained.
That's the test we continue to use today. There are now over...
so I just need to... So the current test works?
Current test works.
Okay, great.
Good. Good.
Current test
but
works.
Wait, there's more.
They're reporting out that 48 countries have coronavirus
Oh,
cases.
48.
In Italy, it's skyrocketed now to 650 cases. South Korea has now 1,700 cases. As you yourself stated, there are more new cases in South Korea than in China. Why is it that we're only testing people who have traveled to China?
Yeah.
That seems to make not a lot of sense to me.
Yeah, why?
Well, when this outbreak originally occurred,
I'm talking about right now, not when it occurred. Right now, why are we testing
Well,
people who have traveled to South Korea, traveled to Italy, traveled to the 11 European countries where there are now coronavirus cases?
we're continuing the travel restrictions that were initiated.
No, I'm just talking about testing people. Why don't you expand the test? Because there's a person in Northern California that doctors recommended get the test. And CDC said no, because the person had to travel to China. That's just really stupid, because we know this is expanded.
Stupid!
48 countries, every continent except Antarctica has these cases. We really should be testing people, not just those that have traveled to China. Can you commit to expanding the test to beyond those that have just traveled to China if they have the symptoms that look like they have coronavirus?
Congressman, I mentioned earlier, I think, before you were here, just so you know, we initially had a geographic restriction. We have changed that. We've posted there's a no geographic restriction. That if a clinician or a health department official considers coronavirus in the differential diagnosis, that now meets our criteria.
When did you make that change?
We made that, well, yesterday we did it and we posted it today.
Stupid! When it's too late! Stupid! Yes! But at least they changed something.
In terms of transmission, because earlier you said people shouldn't be afraid. My understanding, based on the articles, Reuters reported that coronavirus contagion rate makes it hard to control. And there are these two scientific studies that show essentially each person infected with coronavirus is passing disease on to between 2 and 3 other people on average at current transmission rates. And then if you've got this long incubation period, potentially 14 days or more, you could have an exponential explosion of cases rather quickly.
I'm sure
in
we
Italy,
already
is
have
correct?
that.
I think we've seen that obviously in Italy, Korea, and Iran, and yet.
All right, so this person in Northern California who didn't travel to China, where we don't know where he got the coronavirus, he could have passed on to 2 more people, who passed it on to 2 more people, who passed it on to 2 more people. So there could be a whole cluster of cases.
Let's not forget that that patient in Northern California was actually transferred from another hospital. So now they're going to have to backtrack and see all the healthcare workers that took care of that patient who tested positive after CDC finally agreed to test him. We're going to have to track down all those healthcare workers in the previous hospital who've gone home to their families, seen their friends, and then have to track down the people in UC Davis also who have come in contact with the patient.
Pass it on to 2 more people, who pass it on 2 more people. So there could be a whole cluster of cases, but until as of yesterday, we don't know because we weren't testing anyone who didn't travel to China. Am I understanding this correctly?
The current public health evaluation of the case in the chairman's district is being led by the state public health system of California, and we're supporting it. We have a large number of contacts that have been evaluated, that are being isolated, that are being tested to really look at the fullest extent of the potential transmission around that case.
Thank you. I'm going to conclude by saying Donald Trump has attempted to minimize the coronavirus outbreak. There's an article in the Daily Beast titled Coronavirus may explode in the U.S. overnight, just like in Italy. I request that when the data and science contradicts what Donald Trump says, that you follow the data and the science. I yield.
Okay, I'm just going to backtrack a little bit. I don't know if I understood Dr. Redfield's answer. So there could be clusters, yes, but they are monitoring it. They're monitoring all the people? I think that's what he said.
By saying Donald Trump has attempted to minimize the coronavirus outbreak. There's an article in the Daily Beast titled Coronavirus may explode in the U.S. overnight, just like in Italy. I request that when the data and science contradicts what Donald Trump says, that you follow the data and the science. I yield back.
Yeah, I could just say that I commit that CDC is science-based, data-driven service organization.
Science-based, data-driven, but you have no common sense. And the hospitals are relying on you.